As the Trump administration continues its efforts to downsize the federal government through widespread cuts, some are concerned about the future of Medicare and Medicaid.
More than 2 million people in Arizona are enrolled in Medicaid. Some Arizona medical leaders say any cuts to the groups would have a devastating impact on people as well as hospitals, especially in those rural areas. Michael Raimondi live at Wickenburg Community Hospital with a deeper look at what could happen, Michael.
Yeah, this facility covers a large part of central and western Arizona, northwest of the valley, and there were 70,000 visits at this facility just last year. So if these cuts were to go through, the big debate now is what would happen to facilities like this, and would they close down? This is not a massive hospital, but it serves a big purpose. 3,300 square miles of central and western Arizona is covered by the Wickenburg Community Hospital.
Some of those towns are 50, 80 miles from Wickenburg, and they travel a great distance to get here.
The president and CEO of the facility, Jackie Lundblad, says the rural hospitals like this are just so important for smaller Arizona communities who might be hours away from a big hospital in the valley.
We're here for a reason, and that's to really be that stopgap for an individual that needs health care.
They can be the difference in time between life and death. That's especially true for one man who drove himself to this hospital while having a heart attack.
This organization saved his life. Had it not been here and he had to continue driving down into the valley, he would have died along the way and probably taken somebody else with him.
If the White House decides to keep cutting programs like Medicaid for seniors or Medicare for lower income families, hospitals like this could close.
If you begin to erode that, the healthcare system begins to erode.
President and CEO of the Arizona Hospital and Healthcare Association, Anne-Marie Alamadine, says that they've seen this before. When coverage for patients are cut, people tend to stay home and not seek treatment, and they can become sicker. Hospitals that aren't as busy can then be forced to make cuts to staff. It's a domino effect that can impact the entire community.
We're just very concerned for those people that they be able to continue coverage and get the care that they need.
Yeah, the president of that association says they are trying to do absolutely everything they can to make sure cuts aren't made to those programs. Of course, we'll keep you updated on what the White House decides over the next several months. Reporting live in Wickenburg tonight, I'm Michael Raimondi for Arizona's Family.